very Latino. Today I'm going to show you how I use Dissect Aid from Decal to find lymph nodes in cancer specimens. I've used it successfully on specimens from throughout the GI tract and even prostate and uterine tissues. Today I'm going to show you how to use Dissect Aid to find lymph nodes in a colon cancer specimen. I use Dissect Aid because it's the only product that makes it easy to find lymph nodes. I'll show you what I mean in a second. When I get a specimen from the OR, it's usually a 10 to 12 inch piece of colon that is either fresh or formalin fixed. The first thing I do is take the colon out of the container and with the scissors, I open it up to expose the inside lining of the colon and the cancer. This will fix the tumor, any polyps, and the remaining mucosa. After taking the appropriate sections for pathologic review, I remove the fat, slice it a bit, and then put it in Dissect Aid. As you can see, or not see, the lymph nodes are hard to pick out. Typically, with a specimen that's formalin fixed or fresh, you'll have to cut the fat and feel around with your fingers to find the nodes. That's not easy. Many patients now receive neoadjuvant chemotherapy before having their colon resected. The chemotherapy can considerably shrink the tumor, but it also shrinks the size of the lymph nodes. Oftentimes, the lymph nodes may be only 1 to 2 millimeters. They can be almost impossible to find fresh or formalin fixed. Current guidelines recommend that at least 12 lymph nodes should be evaluated during colon cancer resection in order to ensure adequate staging. That's where Dissect Aid comes in. It turns the nodes white so they're easy to identify and remove for testing. After that, the specimen needs to sit in Dissect Aid for about 6 to 8 hours. It can also be left overnight. And when it's done fixing, you'll see that the lymph nodes have turned white, which makes them much easier to discover. Lymph nodes can range from 1 millimeter to 4 or 5 centimeters. To remove them, I use a scalpel and a clean blade. I cut the lymph nodes out of the fat like this. Then I put them in a cassette and put them back into formalin for routine processing. The number of lymph nodes I harvest can vary. I average about 25 lymph nodes on a segmental resection, but with Dissect Aid, that yield can be up to 40 nodes. I always submit all of them for testing so that the pathologist can check as many as possible for tumor. Because if the pathologist finds a tumor in one of them or none of them, it has an impact on the patient, their prognosis, and their treatment. The thing about Dissect Aid is it increases the yield of lymph nodes, and that's extremely important in what we do.